We conducted a phase 1 clinical trial using Pevonedistat with Azacitidine and Venetoclax in patients with relapsed and refractory AML. So generally relapsed refractory AML, these are patients who have unfortunately poor prognosis and they need more novel therapies. Pevonedistat is actually an inhibitor of an enzyme called NED8 activating enzyme. And what it really does is it upregulates NOXA and inhibits MCL1. And MCL1 is an important pathway that is upregulated in patients who have BCL2 inhibitor resistance, such as Venetoclax resistant patients. So what we tried to do on this study is to basically see, by adding Pevonedistat, are we able to actually improve the outcomes of patients with relapsed refractory AML who otherwise get treated with the Azacitidine Venetoclax based therapy. So this was a phase 1 study. It's a dose escalation study where we use the standard doses of Azacitidine and Venetoclax in these patients. These are relapsed refractory AML patients. We used 3 different doses of Pevonedistat in a dose escalation, separate cohorts. And what we found was generally the drug was well tolerated. It was safe to combine with Azacitidine and Venetoclax backbone in this patient population. We observed an overall response rate of about 46.7% in the whole population. But what was very interesting was in patients who had relapsed or refractory AML, but they never received Azacitidine or Venetoclax before, 5 out of 7 of those patients actually achieved a CR. So numerically a very high number, although it's a small population of patients in the study. It was very provocative to see those high numbers. And it at least establishes the proof of concept that trying to target NED8 pathway and potentially trying to see if we can overcome BCL2 resistance could be a potential way to actually improve the outcomes of patients with AML. And hopefully we'll have more studies in the future to explore that pathway as well.